Hi, I'm Chris Little. I'm the news director at KFI AM 640 Radio, and we are continuing our conversation with members of Providence St Joseph Health. We're talking about their innovative strategies for healthcare. And today we're talking with Aaron Martin. He's the Executive Vice President, and he's the Chief Digital Officer of Providence St Joseph Health. And Aaron, thanks for coming out today. I appreciate it.
Thank you.
First of all, what does a digital officer do?
Yeah. It's not as common in healthcare as it is outside of healthcare. So,
Sure.
So the role is more kind of prevalent right now outside of healthcare, and my team's basic purpose is to transition our customer relationship from an offline, like kind of traditional healthcare relationship, to more of a digital relationship with our consumers. And so, so there's a bunch of different kind of components to that. One is obviously the technology that you work with. Another piece of it is marketing. So how do you hear about us? How do you kind of hear about the brand, those types of things? And typically a chief digital officer has both of those pieces reporting into them, the customer-facing technology and the marketing piece.
So your job is to make Providence St Joseph, the customers, more focused and technology enabled.
Yeah. So the way I think about it is, having a relationship with Providence St Joseph that's very similar to how you would interact with any other kind of company, in a modern way. So. One of the things I always kind of talk about is when's the last time you made a phone call to schedule anything? For me, it's been a while because I use my kind of app and my phone to kind of do most of the scheduling. So,
Right.
for instance, to make a reservation at a restaurant, those types of things, to communicate with companies either through texting or email. Healthcare is way behind the time, and so if you think about it, it's probably one of the few times that you actually call somebody to schedule an appointment is one of many different examples of the different ways that we've got to kind of bring the industry up to speed from a digital standpoint.
Give me a little background about Providence St Joseph Health.
Yeah, we're a big health system, $23 billion in revenue last year. We span 8 states. We have about 116,000 caregivers and kind of employed with us, and it's a mission-based nonprofit health system. And so, what I'm most proud of, and one of the reasons why I joined, is our focus on kind of this radical inclusivity. So making sure that we deliver care to anybody who needs it. So last year, I think we delivered about $1.2 billion of community benefit. So that involves free care, that involves lower price care for those that can't afford it, and really trying to kind of serve the community and fulfill that mission.
How did Providence and St Joseph come together?
They came together through an affiliation and kind of two like-minded mission-based health systems, and it was really kind of a natural process. And specifically, for instance, in the LA Orange County market, really no overlap. St. Joseph's in Orange County is one of the largest health systems there, and then Providence and LA is one of the largest health systems there. And to give you an idea, it was kind of hand in glove, both from a geographic standpoint as well as a cultural standpoint. It was interesting. Our first kind of interactions with the team from St. Joseph's was amazing because it's as if we'd been working together for decades. It was really quite incredible. The same kind of group of folks that really cared about taking care of the poor and the vulnerable.
And at that time when you came together, was there this push for digital?
Yeah, I think that's kind of preceded it, that coming together, but at least on the Providence side and certainly on the St. Joe's side. But it's really, we've kind of redoubled our efforts in that area as well. It's really important today. If we don't disrupt ourselves with a different business model, somebody else will. And so, and if you kind of engage in kind of your own efforts at disruption to kind of change the way you do business fundamentally, you have a vote in the future. If you don't, Your terms will be dictated to you. And that's something that I learned in my prior background before coming to Providence. And this is certainly true right now in healthcare.
Yeah, it seems like the most successful organizations out there have been market disruptors.
Yeah, that's exactly right.
And Providence St Joseph Health has been quite innovative, and that's I've learned that from speaking to several people now from your organization. How has that evolved?
The way that we kind of fundamentally think about digital in a healthcare context is no different than any other industry fundamentally would, which is, I always talk to people that if you talk to any chief digital officer from any industry and you kind of listen closely to their strategy, it'll break down into kind of two fundamental parts. One is creating what I call the 10x better experience, online versus offline. And that first part is about creating something that's so much better that it causes people to kind of adopt a new way of doing things, right? Mm-hmm. So if it's only kind of 10 or 20 or 30% better, typically humans they'll just kind of revert to what they know and what's safe, right? And so the example I always use in that case is if you told somebody, hey, here's product A, which is you kind of drive a long distance, you kind of wait for 30 minutes to an hour in a primary care clinic, and then you wait another 10 minutes within the clinic, and then you see a clinician for 5 minutes. That's product A. And product B is you can basically pull out your phone and see somebody almost immediately for that same 5 minutes. Which would you choose, A or B? And what will happen a lot is people will say B, but then they'll still revert to A. And it's because it may not solve all their problems. And so the example I always use about the 10x better experience is take what Lyft and Uber have done. They haven't just kind of slightly improved the ability to kind of hail a cab. They've changed it dramatically. So you can do online payments. You can see if the car is lost using the map and that kind of thing. So they solve a lot of different problems. So it's got to be 10 times better experience. And then the second part, what matters is once you've gotten a consumer to try your new offering online, to switch from kind of doing things the old way to the new way, is you got to create an engagement platform for them. And what that means is you got to keep them continuously engaged digitally, right? And a lot of industries have an easier time than healthcare does. So for instance, the example I always use is Starbucks, where, I use Starbucks, I'm from Seattle, I use Starbucks every day, right? So what they need to do is less challenging than healthcare because they just got to make that transaction easier digitally to pre-order your coffee or whatever, and you're going to use that product, continue to use that product every single day. Healthcare's got a different problem. Healthcare's got a problem in that, fortunately for us, most of our customers, our patients, are relatively healthy. So we see them about 2.5 times a year, right? Mm-hmm. And so our challenge is how do we stay relevant with them between episodes of care? And so how do we stay, and the answer is to pivot from, and this is a business model shift that we're taking as an organization, pivot from being a sick care organization where this is where you go when you're ill to being a health organization. This is where you go to stay healthy, right? And to engage across that. And so we've been doing a ton of work around making the transaction easier, so the 10x better experience, and then also creating an engaged digital experience across those different areas. And I can kind of go into detail around any of those different areas.
Well, is the 10x better experience, are you happy with it? Is it working the way you want it to work?
Yeah. We've seen, we've launched a product called Expresscare, which is highly digitally enabled. And what it does is it focuses on, what we call low acuity healthcare. And so what that means in kind of layman's terms is something minor and episodic. So think like, do I have strep? Do I have a UTI? Something, small, not life-threatening, and something that happens intermittently, right? And usually how patients get seen in that for those types of illnesses is they go to their primary care physician. The problem that we're solving is most primary care physicians are so booked that it's going to be a week or possibly 2 weeks out before you can be seen. But you're suffering right now.
Right.
And so how do we deliver that care instantly? And so what we've done is we've built these small little clinics that are embedded within Walgreens and the Seattle and the Portland markets. We've built a digital platform around them. And so what you can do today is with one touch, schedule a same-day appointment. The mobile device, the mobile app that we built, kind of shows you which clinic is closest to you based on where you're located. You can also do a telehealth visit, so you can actually initiate a video conferencing visit directly with a care provider if you don't want to leave your home. And you can also summon somebody to your home. So you can summon sort of like Uber or Lyft. You can summon an ARNP, a nurse practitioner, to your home to take care of you if you, say for instance, your entire family's down with the flu or something like that, right? And you just want to see everybody seen all at once. Super convenient, super easy technology, and what we've seen is a massive uptake, from consumers. So last year we did about 140,000 visits through that platform in those two markets. About 55, almost 60% of them were scheduled online, which compared to normal healthcare, it's about 1 to 5% are scheduled online. Visits are scheduled online. So a 10x bigger, more people are scheduling online. We did about 10,000 video visits, so telehealth visits. And and then about 30% of the patients were new to us. So we were also gaining share in those markets using this technology. So that was a huge thing that we've kind of launched and starting to scale, and we have ambitions to add hundreds of more clinics over the next 18 to 24 months.
Well, I don't totally understand how that works. I mean, I understand how it works, but I mean, it seems like, number one, it'd be expensive, and number two, as you're bringing 30% more patients on, you have to hire more people, right? Yep. Okay, but you could hire those people to put them in a building too, couldn't you?
So what happens is, the reason why it's less expensive and more efficient is a couple of reasons. One is you're choosing to use a lower licensed individual. So these are nurse practitioners, folks that can see kind of lower acuity issues, lower severity issues. They can still prescribe in the state of Washington and Oregon. They're overseen by physicians. That's the first thing that kind of makes it more efficient. I think
it's the same in California too, right?
Correct, correct. The second thing that makes it more efficient is because a lot of times in those clinics, the nurse practitioners may see somebody at 11 o'clock and then at noon, and for 15-minute visits, and they have all these gaps in the schedule. Because we can open up telehealth, we can fill in those gaps with anybody in the state, even if they're not close to a clinic location. So we can see somebody in Walla Walla if they're not close to an Expresscare clinic that's located in Seattle. And so it fills in those gaps, and so that the nurse practitioner's time is better utilized, and so we get much more efficiency out of that platform.
So you're being more efficient. Are you putting a heavier burden then on the nurse practitioner?
Well, what we're trying to do for the nurse practitioner, that's a great question, is to make the visit more efficient. So we've narrowed the scope so they only see a limited number of things, so that lowers the complexity of some of the cases that they'll see, number one. Number two, we've created some digital tools to make it a lot easier to execute on the visit. And then we're starting to kind of experiment with some things that, a little bit further out around, for instance, using, new voice AI-assisted technology that would allow you to kind of chart through voice instead of having to type. So if you've ever been in a physician's office or a nurse's office, that thing that they're kind of typing into, it's an EMR,
right? And
it's very kind of labor intensive, and it also distracts them from the care that they're providing to the patient. So what we're trying to do is figure out a way of making, how do we use technology to make that easier for them?
You mentioned AI. How has artificial intelligence impacted your business, or actually what Providence St Joseph Health is doing?
Yeah, we're still at the super early stages of it, and what I'll tell you is, I think typically what happens with these new technologies is you have to go through a phase of just using them to speed up processes that you already do using old technology. So what I mean by that is, when the internet first kind of presented itself in the 90s, what you saw a lot of media companies do, for instance, like magazine companies, they basically took the offline magazine and they put it online. So
Right.
if you remember what these things looked like, they were pretty much like, representations of what you'd see printed, out on the coffee table. And then they started to kind of work with the technology, and it presented all new different ways. It turned into social media and some other different things that you couldn't even imagine right now. Where I think we are with AI and ML is people are using it for some very basic things to speed up processes that they've been running in older technologies. I think what's coming in the next 5 years is going to be, all right, here are new applications that we never even could dream of for this technology. So how we're using AI is we're starting to experiment with what's called bot navigation. So you get online and you kind of start texting with an agent and basically an AI bot, and it starts to kind of direct you to, you give it some symptoms and it says, okay, that sounds like you should go to your primary care doctor, you should go to an Expresscare clinic, you should go to the ED because it sounds pretty serious. So trying to kind of navigate patients to the right venue of care based on some very kind of, simple parameters.
No, that's fascinating.
Yeah.
Well, you mentioned the internet when it first came out, and then of course, later on, Facebook and some of these things. People, in some cases, were slow to adopt them.
Yeah.
But nowadays, everyone's just jumping on it, right?
Yeah. It's. I mean, the interesting thing for us working in healthcare is we're so far behind where the rest of the internet is.
Why is that?
It's because there's a whole bunch of good reasons. One is regulation is a big one. So, for instance, there's a lot of complexity around how health systems are regulated. We're regulated at the state level, the federal level, and there's a lot of very, very important and correct regulation around privacy, for instance, that don't exist in other areas.
Right.
And then that's the first thing. The second thing is, up until probably, I would say about 10 years ago, most of the big health systems weren't really enabled in a big way on electronic medical records. And so that started to kind of come into place. So the fundamental data, in a lot of cases, call it 15 years ago, 10 years ago, was being kept in, like you see, if you watch an old episode of ER,
Right. Yeah.
they've got a folder there, and that persisted until about 15 years ago.
Yeah, we don't see those carts walking around anymore with
Right.
folders in them.
Yeah. So
It's fascinating. Yeah.
So there's a lot of reasons why this has happened. My hope is we kind of accelerate and kind of get to where the rest of retail and media and all these other financial services have gotten to.
Well, it seems like Providence St Joseph Health is going to get there because everyone that I've spoken to, and I said this to the last person I spoke with, they're passionate.
Yeah.
And I think you're passionate about this. This is Aaron Martin. He's Executive Vice President and the Chief Digital Officer at Providence St Joseph Health. We're just talking about their innovation. And I read something about you. You have an innovation mission. Tell me about that.
Yeah, so the mission of the organization is to, for my team, is again to kind of fundamentally transform the way that we deliver care as an organization. And so what that means is I'm a big believer that there's a theory in healthcare that I think is slowly being debunked, which is the best way to contain costs is to limit some access, right? And I think it's the opposite. And I think what we need to do is provide more access to people, and provide it in a much more kind of cost-effective way. So I can imagine over the fullness of time, very small, minor things being, kind of being served through what we talked about, like video visits,
Right.
things like that make it just more efficient to kind of deliver care. And then if you take that same, from the mission standpoint, if you take that same kind of technology, a big question I always get is, that's great. Sounds like that really only helps the middle and upper income. And my response is convenience or the lack of convenience, so inconvenience, hurts lower income way more than it does middle and upper income. So for instance, the example I always use is we're working right now on a project to figure out a better way for our EDs, or our ERs, our emergency rooms, to be utilized. This is the most expensive place you can receive care. And yet, probably anywhere from 20 to 40% of the visits that happen in an ED could have been done in some lower cost place, like primary care, urgent care, Expresscare, those types of places. And so we're trying to kind of peel back why that is. And in a lot of cases, a lot of the folks that are using EDs for kind of these lower acuity events, it's for primary care basically, it's because they have no other access alternatives that make sense for them. So the example I always use is if you're, somebody who's being paid hourly, has got, a day job, and you're feeling bad, or your kids are feeling bad, and you need to get care for them, guess what? Most primary care is not open after hours. So what are you going to do? You're going to go to the ED.
Right.
And that's the most rational thing for you to do. So what we're doing is we're providing extended hours, telehealth, so you can be seen from your home after you get home from work. And we're starting to kind of pivot a lot of the technology that we built for the Medicaid population, folks that may have problems kind of, getting access because they may have a hard time moving, those types of things, trying to deliver care into the home more effectively.
What percentage of people don't need to be seen by a person? I mean, in other words, they can use digital technology.
Yeah, I think that's a great point. A lot of folks today go see what we metaphorically call it Dr. Google, right? And so the
Right,
sad thing is, Dr. Google is wrong a lot.
Yeah.
And Dr. Google from time to time can convince you have cancer when you don't, right?
Yes.
So because and so as one example, and so if you got a little kind of tint of hypochondria in you, it's not a great place to go look for medical advice. And so what we've done as one example of kind of both leveraging technology but also making it credible is we launched a service called Circle. And what Circle does is it focuses on expectant mothers all the way through pediatrics, and now it's moving on into women's health. And recently, we combined Circle with a company called Wildflower Health, which was doing the same kind of thing in and we're now investors in the combined entity. It's the same, did the same kind of thing for payers and providers that we do for payers and employers that we do for providers. And what it does is it basically curates content for the expectant mother to make sure that she's getting the correct advice digitally.
Oh, and breastfeeding. And
exactly.
That kind of thing.
And really fundamentally, what a new mom wants to know is this normal, right? And it does an exceptionally good job at the kind of, the age of the pregnancy to kind of answer those questions. And so then the reason why the patients love it is it's like having an OB in their pocket or in their purse. And then the OBs love it because, they're able to spend more time with the patients talking about their specific issues, and they can kind of skip over all the basic questions like, can I have sushi, those types of things, right? Which they may get bad information on the open internet around that.
Sure.
So.
Well, Providence St Joseph Health, you guys created Circle and then spun it off, right?
That's correct.
Okay, and
we spun it into a company called Wildflower Health, and so we combine these two things, and it'll be, it's going to be tremendous, because what Wildflower has done is they've done the same thing for payers and employers. So what we'll be able to do in the future is have that mom can first of all go through pregnancy, pediatrics, start helping kind of a broader women's health platform, and then she can also do things like understand, will her payer pay for this service? What kind of benefits does she have? In addition to being able to kind of communicate directly with her OB, with her pediatrician, and all the folks on the provider side.
Wow, that's pretty powerful.
Yeah.
And are you guys working on other apps and processes like that?
Oh yeah. So We before we spun out Circle, we spun out a company called Zelf, Xealth, and what they do is very powerful. Is they allow any kind of clinician, working at their EMR, so that thing that they're typing into at in your visit.
Right.
In the same way that they can prescribe to you a pharmaceutical and have you go kind of pick it up at the Walgreens, what they can do now using this technology that Zelf has built is it allows them to prescribe anything else that's digitally enabled. So say, for instance, you've had problems with your knee, they could prescribe a brace. They could prescribe a lift ride if you need help to get to a clinic. They can prescribe OTC products. They can prescribe digital apps and content. So, for instance, from a content standpoint, so I think you spoke to Ira Byock, is that right?
Yes, I did.
So one of the things, the pieces of work they've done for Ira and his team is, advanced care planning modules, so that if somebody is kind of in a specific situation clinically, they can say, hey, really need you to kind of look at these advanced care planning videos, and it'll prescribe them. Then all they have to do is on their Providence app, it sends them a little card and says, your physician has prescribed this video for you to watch. You click on it, downloads it, you're good to go. And the clinician can see in their EMR if you've watched the video, if you've read the article, if you've used the lift ride, if you've bought the brace. And so it's very similar to like how prescribing any pharmaceutical is. And that goes to like our overall model within my team, which is what we do is we, when we're looking at these various different kind of opportunity areas to go innovate, we first look and see if we already own the technology. If we do, great, we'll use that. Then if we don't own the technology, we'll leverage, we have a venture fund that I also run, Providence Ventures. They'll go out and they'll look for what we call best of breed companies, and we'll actually partner with them and invest in them. So that's where our venture portfolio
So that's your
from.
venture capital program.
Correct. And if we don't have it, can't find it through the venture fund, then we'll build it. And if we build it, we'll spin it out as a company. And so Zelf and Circle both kind of came out of that program.
Well, that's pretty cool. Very innovative. So what's your investment focus areas then?
Yeah. So Providence Ventures, we've got 13 portfolio companies in it. It's led by 3 investment professionals, and it's a $150 million fund. And the different areas line up exactly with the different areas that we're trying to innovate in that we think are going to move the needle for the health system. So one of them is consumer engagement and digital engagement. So this area that we've been talking about. Like, so all right, so how do you make the health system easier to use from a digital standpoint, right? Another area is Medicaid, so we talked a little bit about that. Another area is behavioral health. So I know that you spoke to Tyler as well. So we're doing a lot of work with him and his team on that. Another area is making caregiving easier. So how do you turn technology from a bug into a feature for a clinician? Because right now, a lot of the technology they have to use is a little bit hard to kind of manipulate and deal with. How do you make it just as seamless as if they're using any kind of consumer technology to serve their patients?
And the public's embracing this, right?
Oh yeah.
I mean, seems to be a demand for it.
Oh yeah.
Honestly,
there really is. There really is.
There are some companies getting into the healthcare business. Create health insurance companies. Large companies that people would know if I mention their names. What do you think about that?
Yeah, so like Amazon, Microsoft, Google, Apple. Yeah, there's a lot of companies kind of looking at the healthcare space, and what attracts them to it is we're roughly 20% of GDP. So the thing I always tell people is we're the 5th largest economy on the planet behind Germany. If you take just healthcare, U.S. healthcare as a separate kind of economy, it's absolutely massive. That's not good, by the way.
No.
We spend way too much in this country on healthcare. And they're seeing this as this inefficient, industry, which it is, and they're looking to kind of provide their services into it and potentially disrupt it. And I think what is encouraging to me is that they're hiring, they're going into it eyes wide open. These companies, they're hiring experts from healthcare. They're not simply just kind of diving into it. So they understand that it is an incredibly complex industry. And then I think the other thing too is they're leveraging what's been used in other industries to drive value. So for instance, with Amazon, Google, and Microsoft in particular, leveraging their cloud infrastructure and working with health systems and health insurance companies to figure out, all right, traditionally you've had these kind of non-cloud infrastructures at these data centers. How can you kind of move that into the cloud, make that easier? How can they work with a lot of the kind of legacy technology companies to kind of move their services into the cloud? And the reason why that makes so much sense is once you make these technologies more cloud enabled, they can be iterated faster and you can make progress faster. So they can make changes faster because they're available everywhere, right? So
are these companies going to be your competitors, or are you going to wind up working with them? Will they hire you to work with them?
Yeah, I think it's going to be both, right? And I think one of the things that I got used to, I worked at Amazon for 10 years almost, and one of the things you get used to in technology is over here you're working, very closely with a company, and over here you're competing with them, right? So
Right.
at Amazon, Google was, a huge partner from the traffic standpoint. We were Google's largest customer, I think, at some point, in terms of buying traffic from them through their AdWord program.
Right.
And then we're also competing with them in cloud, and we're competing with them in video and some other areas as well. And so you have to just get used to the idea that you're going to be partnering and collaborating in some areas, and in some areas you're not. You're going to be competing with each other, and you just get used to that, that dynamic environment.
How's Providence St Joseph Health using technology to reach out to the vulnerable?
Yes. So I think the key thing there, as I'd mentioned before, is making healthcare more convenient and then also accessible. And so that doesn't just mean, hey, making it available on a smartphone.
Right.
It also makes sure that it's available in like the right language, for instance, right? So we've invested in a company called In-Demand Interpreting, for instance, and what that company does is it allows, I think, over 20 languages. You basically select the language and the gender of the translator that you want, and instantly up pops somebody translating, a medical grade translator who can do translation between your physician and the patient.
I think it's important you said medical grade. I mean, it's not just
some person.
Right. Yeah. Wow. Yeah.
Yeah.
That's a high level translator.
Yes.
Definitely.
Yes. And so we use that technology within our hospitals. We're starting to experiment using it in primary care. And one of the proudest moments I've had is I remember we had a friend of ours whose friend was coming in from overseas, and she was Thai and didn't speak a lot of English at all, and unfortunately had a health issue. And so we called. They called one of our competitors in Seattle, and the next closest available time in which they could offer this individual a primary care appointment with a translator was 3 or 4 weeks out.
Oh.
And then they called us, and we put them in touch with a clinic, and the clinic was able to offer them next day with a teletranslation. And so like right there you see kind of the fruits of your labor of like, we can pretty much take anybody with any kind of language issues immediately into any one of our locations. And again, it's about this radical inclusivity of our platform.
That's
We're
pretty
open to
high level
everybody.
interaction there.
Oh yeah, it's great.
How are you guys, I know there's a big mental health focus, and how does technology enter into that?
Yeah. That is a big big opportunity for technology. And the reason is because there's two big opportunities. One is something called CBT, and it's computer-driven therapy, right? And so this is where no human is involved at all. And this has been proven to be effectual in certain low-grade anxiety and depression, therapies, right? And so that can be just distributed highly efficiently if we can just kind of connect the patient to that therapy. Then the second opportunity for things that are a little bit more acute is telepsychiatry and telepsychology. Right. And so what you can do there is because most of that is kind of face-to-face interactions, you don't have to necessarily touch the patient and do physical exams and that kind of thing. That can be delivered through video conferencing. And we think in digital, the fundamental problem that we're going to be able to help solve is the supply of mental health professionals is incredibly constrained. It's not growing at a rapid enough pace, and the problem is it's also being allocated when things have gotten out of hand. So, for instance, typically you see in a health system that they're engaging when somebody is in an ED and is having some sort of crisis, right? And what we want to do is we want to take some of those resources and push them upstream into primary care, using telehealth and using CBT and using digital to also identify patients who may have some of these issues at a much earlier stage before they kind of progress and get worse and worse and worse to where they end up in the ED. So if you can kind of push it upstream and distribute it a lot better through technology, I think it'll have a profound effect.
This seems like digital utopia.
Yeah.
Are there any challenges that you have with this?
Oh yeah, I mean there's a ton of challenges.
Oh yeah.
I mean one of the things is that I'll give you one example. In a primary care clinic, in particular, it's set up to deliver care in a specific way, in the most efficient way they possibly can. Right. And so if you have to have the technology be prevalent and used constantly. It can't be you can't expect a physician to change the way they treat, every 10th patient, right? Like they need to be able to say, look, I'm going to do this either for everybody or nobody, right? And that is incredibly challenging for them from a workflow standpoint. If you're asking them, for instance, to do a telehealth visit every 10th or 20th patient, right? Because it doesn't work in the flow, right? And so one of the reasons why we created Expresscare is we took out these lower acuity, like low, things that people wanted dealt with immediately that weren't very serious, and then we used that and turned that into and did a lot of kind of work around telehealth. And what you find is once you kind of start to concentrate and you rework the way that the workflow happens, you can make it scale and be more efficient. But if you ask somebody to do something every 10 visits or every 20 visits, it's more disruptive than it is helpful for everybody involved. So you actually have to kind of rethink the different way the working model works.
Did you discover that by doing it?
We discovered that by, the story I always tell is when I first got to Providence St Joseph is, I had this ambition that we're going to kind of digitize our primary care clinics, right? And primary care clinics serve such a variety of different patients that it's just not a realistic expectation day one. And so what we found was the first couple of clinics went really, really well, and it was because we had brand new clinics with brand new physicians that were setting up to practice in a new and different way. Right. By the time we hit the third clinic, which was an established clinic with like a big, huge, group of patients that they're already serving, it was a lot more challenging. So that's where we kind of discovered, hey, maybe we need to kind of carve this off and put this to the side and work on a brand new model around that with Expresscare.
That's interesting.
Yeah.
So that's obviously working well for you. Mm-hmm. Are there enough developers and idea people out there in this world to keep coming up with these kinds of innovations? Or
yeah.
What do you need?
Yeah, I think the challenge is this has gotten less problematic because the market has a way of kind of winnowing, non-impactful ideas out. But early on, like 4 years ago, you saw a lot of well-meaning entrepreneurs coming from outside of healthcare, and they'd have some sort of interaction with the health system that was bad, and it was usually a very edge case scenario. And they would say, I'm going to go fix that, and ergo, I'm going to fix healthcare. And a big part of the problem that we've kind of solved for within our health system is about identifying the areas where we think are going to be needle movers for the health system. There are so many different things you could apply digital technology to, and it would be helpful, but not all of them are going to have a profound economic or clinical or quality impact. So you have to be really, really careful about kind of choosing your battles and kind of prioritizing things, right? Because you could spend a lot of time and effort on stuff that's pretty cool and neat, but really isn't going to have an impact on kind of transforming the health system's economics, its efficiency, its quality, its clinical outcomes, that kind of thing. So we're very focused on working with our partners within the health system, like the folks from clinical, the folks from physician services, the folks from population health who know these issues front to back and saying, what are the biggest problems you're trying to solve? And then us taking a look and saying, can digital be helpful? Sometimes it's not. Sometimes it would be premature because there's a lot of operational things that you got to fix first. Sometimes it would be helpful, but it's not going to be the thing that's going to make or break it, right? So you got to basically go through a very thoughtful process to determine where you're going to kind of apply what my team does.
I know there's a lot of regulations that affect this, but I'm wondering about the mindset later on down the line. 15 years, you're going to have new doctors and new clinicians, new everybody.
Yeah.
They'll embrace this digital thing differently, and then 20 years from now, when you look back, you're going to say, "Wow, digital really affected healthcare like I thought it would, or more than I thought it would, or less than I thought it would."
I think it's going to have more of an impact. I think one of the key principles about technology is we as humans, and you hear Thomas Friedman talk about this, the folks at Google have talked about this, a lot of kind of key thinkers have talked about the fact that humans think in linear terms, right, and technology progresses on an exponential curve. And so our anticipation of how technology is going to impact our lives is short-sighted.
We have no idea.
Yeah, and I think what you'll see is you'll see progress very rapidly accelerate in this area. So you'll start to see a huge impact of genomics in the not-too-distant future. Google is working on that in a big way as part of Verily. You'll see a huge impact in terms of the customer, service and access aspect of it through, the work that we're doing, the work that Apple and Amazon are doing. You'll see a huge impact in terms of the way that data is being used to serve consumers. So, again, all these big all these big technology companies are working on those areas as well. And I think what you're going to see as well is a startlingly high percentage of use of artificial intelligence and machine learning in it.
All right. We're out of time. Aaron Martin, VP and Chief Digital Officer for Providence St Joseph Health.